I understand that the government, I've seen that the government haven't amended our motion, and I presume that the government are not opposing it, and this is a tactic that I will address more in my closing remarks. Sinn Féin are more interested in providing solutions than playing politics, and the solutions are to the woeful neglect of successive governments in the failure in children's and young persons' mental health services. I'm aware that there will be parents of young people who are watching, who are desperately trying to get the proper mental health care for their children. There's a couple of parents that I know that are here in the public gallery today, listening to us today. And I want to echo the Mental Health Commission's statement in their report that states that in some instances, children and young people get excellent care from dedicated staff while they're under the care of CAMHS. And whilst this is true in some cases, it is the complete opposite for many a family. Sinn Féin's motion will ensure mental health services for children and young people are properly resourced, they are fully staffed and provide support when and where they are needed. The scandals in our child and adolescent mental health services were laid bare once more last week. The government needs to act urgently to ensure that we have the services that are fit for purpose for our children and our young people. The current services are not. There are serious concerns and risks for patients currently accessing CAMHS, and this is a second report in relation to children being placed at risk while under the care of CAMHS. Where the government has failed, Sinn Féin want to offer solutions. Early intervention is key. All children and young people deserve the opportunity to reach their full potential. Children and young people must have access to mental health services when and where they need them. Services should be extended to 25 years of age to prevent children from falling off a cliff edge at the age of 18. This was outlined in Sharing Division. The majority of acute, long-term mental health difficulties develop between the ages of 16 and 25, and our mental health services must reflect this. We are calling for multi-annual funding for CAMHS, so CAMHS can operate and forward plan to be able to properly staff teams. We are calling for an integrated IT system to improve quality of care. It is 2023 and it is shocking to the extreme that we do not have an integrated IT system for children and young persons' mental health. There is a fundamental need for greater accountability and oversight across the health service. We are calling for the reinstatement of the National Director for Mental Health in the HSE, who would report directly to the CEO of the HSE and also to the Minister of the Day. There has been no National Director for Mental Health since 2016, despite the current programme for government containing a commitment to reinstate the position. The Minister, you yourself have called for this, but the HSE seem to be blocking this appointment. There seems to be a big disconnect between the Ministers and the HSE. I'd like to know who is in charge. The government must prioritise the recruitment of a Youth Mental Health Assistant Director in the HSE as promised in Budget 23. This post is essential to ensuring leadership in the improvement of mental health service for children and young people, but recruitment has yet to begin. No urgency again. Sinn Féin want to empower CAMHS to be able to respond to issues raised in the Mental Health Commission's interim report. And I want to take another opportunity to thank Dr. Susan Finnerty and the Mental Health Commission for publishing this report early. The report did not come to a shock to any family who has experience of accessing CAMHS. They know too well that this government has been failing young people as waiting lists have dramatically increased under your watch. We must introduce national standards for monitoring antipsychotic medications. We must develop joined-up and comprehensive health and social care workforce strategy to increase education places and training opportunities between the Departments of Health and the Departments of Higher Education. We must increase undergraduate and postgraduate courses and training places for mental health professionals. Minimum staffing levels for CAMHS must be published, so at least we have something to aim for. Our mental health services are in crisis, and Minister, we can do so much better. We owe it to our children, we owe it to our young people. Our young people deserve hope, solutions, mental health services that are fit for purpose. There is nothing worse than denying a child and young person every opportunity possible for them to reach their full potential.